Hello again everyone, Dr. Dan Bockmann here. Today I want to talk about my super overly ridiculously simple approach to rehab for musculoskeletal injuries, and that's head to toe moving parts basically. So if you think about it, our body is incredibly complex. However, if you think about it as just the vehicle that your brain drives around, and our vehicle is made of moving parts, top to bottom, right? And if we can all agree that each moving part has a normal range of motion it should be able to move through, and if it can then move safely, and if it can't, it is then being forced by definition to move dangerously or in an unsafe way. If we can agree on that, and if we can also agree that the primary protection for all of our joints, what keeps us from getting hurt, are the muscles that attach to and around those joints, then we can simplify this really complicated and amazing vehicle that we drive around down into having really only two kinds of problems that can happen, or two main reasons why pain happens. And those are mobility problems and stability problems. Mobility is either I can't move enough or I can move too much. Like let's say I dislocate my elbow or I tear my ACL, that'd be too much mobility. Or frozen shoulder would be not enough mobility, right? So mobility problems or stability problems, meaning the muscles whose job it is to protect me can't, and that allows pain to happen. So that's what I focus mostly on in evaluation for a patient, whatever the injury, whether it's a heel, foot, knee, ankle, back, neck, shoulder, doesn't matter. I look at other things, but I focus mostly on those top two suspects. And I can tell you right now, they break down into most commonly tight things and weak things. And in fact, that's exactly how I describe it to patients. So when I'm done with my consult and exam, I'll tell patients, I like everything I'm seeing. I don't see anything scary. I think you're going to be super easy to fix. I do see two kinds of problems that are both very fixable, and they are tight things and weak things. This is literally what I tell patients in reported findings. Tight things meaning you've got muscles that are shorter ropes than they should be, and they're preventing you from moving normally, which then means you're being forced to move abnormally, and that can cause pain. And weak things meaning the muscles whose job it is to protect you can't, and that can allow pain to happen too. So the solution, loosen the tight things, strengthen the weak things. And they get that. They'll get that immediately. Okay, that sounds pretty simple. And then I say, there in the let's loosen tight things category, there are only three tools that do that. Stretches do that. Massage does that, like foam roller or manual massage. Adjustments do that too. Now, cracking your back or cracking your knuckles, yes, there are other advantages or benefits from those things. I treat them like a mobility tool, meaning if I see someone who should be able to turn 90 degrees and they can only turn 30, and I do a spinal manipulation and they can then move 60 or 70 degrees, that's what I'm going to use that tool for. So stretching, massage, and spinal manipulation are the let's loosen tight things tools. In the let's strengthen weak things side, it's all going to be exercise. We're just going to plug in a few things that I think they may be missing. So that's literally my approach to rehab. Yes, there are other orthopedic tests that I will look at, and I will certainly question them, and I have a lot of information I want to get from them during the consult and the exam or in the history. But if you focus on these top two suspects for musculoskeletal pain, you're going to hit the majority of the reason people hurt, and then you can kind of just pick off some of the little cosmetic things, like who knows, it could be they're low on sleep, or they're dehydrated, or their workstation posture, their sleep posture, or maybe their lifting technique in the gym, or their ramp up angle into the running program is too steep. There's a bunch of other contributors too. I mostly care about the big, chunky, egregious contributors, and they usually break down to tight things and weak things. So anyway, docs and students and anyone else who's interested, by the way, hopefully that's been helpful. If any of y'all have questions you'd like me to address or practice topics you'd like me to go over, leave your question in the comment section below, and I'd be happy to shoot you a quick video answer to your question. Until next time, see you guys.